I went into the practice of medicine because I like people. So when patients come into the office, we don't just talk about healthcare. We talk about their lives. Nephrology is a very unique field. It's an area where we take care of patients for long periods of time. They become part of our family. I think that's probably the best thing. I mean, there's tough times when you have to tell people about less than optimal things that are happening in their lives. But there's a way to do it that they recognize your empathy and they recognize how much you care. The biggest difficulty in medicine is not losing that feeling for your patients. And luckily, I mean, I've been at this 40 years and I still care about my patients and empathize with the situations they find them in. I think that's what makes medicine a wonderful profession.
I have known Dr. Powers for approximately 20 years. I first met Dr. Powers at St. Tammany Hospital where he saw my dad. My dad is from Florida and he would actually drive from Florida to Mandeville, Louisiana so that I would take him to the hospital to be cared for. On one of his visits, Dr. Powers came in to see my dad and address his kidney issues. And he literally came in, sat down next to the bed, and had a conversation with my dad like he's known him forever. I have polycystic kidney disease, and I was seeing a doctor from across the lake. And at that moment, I knew that I had to switch and that Dr. Powers was the person that I wanted to see.
I first came to him because I needed a second opinion, and my former nephrologist wanted to send me for dialysis when I was at 20%. And Dr. Powers, by regulating my blood pressure and getting me on the right medications, kept me off dialysis for 10 years.
I can say that he is probably the most intelligent doctor I've ever seen. And he's very personal. He treats you like family. As far as a doctor, he's the best I've ever had. As far as a person, he's a great person too. I'm grateful for what he's done for me.
Most of the patients we take care of do not require total attention or like academic prowess. It's more taking care of their needs, whatever they happen to be. Whenever that 10% of the patients come in with that esoteric disease, you can't miss it. You have to notice everything that's going on with the patient. So it's things like that that make our practice different than the mundane practices. We're not going to miss that case, and we're going to save somebody's life.